All right, we're going to go ahead and get started for the sake of time. I know we really want to have some extra time and for some Q&A. So I'm Tony Torres PD, and it's my pleasure to introduce Dr. Shana Harrington. She's going to present today on her leadership style as well as her future goals and plans for the DPT program. So what we're going to do is we're going to have her present, and then we're going to give the students an opportunity to ask questions for maybe about 10 minutes, and then we're going to dismiss the students, and then we're going to leave it open for the rest of the faculty and staff to answer any questions that you may have. So we'll do some Q&A with an opportunity for students and then an opportunity for faculty and staff. So welcome, and I'll turn it over to Shana.
Thanks, Tony. Thanks, everyone, for joining me. I can hear the kickback on your computer. Okay, so I didn't know who all was going to be in the room, and I know a lot of you, but I don't know some of you.
I'm an outsider.
It's okay. So I just wanted to go over my background on how I got to where I am today. So I was born and raised in St. Pete, Florida. My mom and dad still live there. Spent pretty much all of my first 18 years in Florida until I wanted to get out of the sunshine and heat. I did my BA in exercise and sports science at UNC Chapel Hill. And then I went to St. Augustine for PT school, which in my opinion is probably the prettiest beach in Florida. If you haven't been, I highly encourage you to go. I actually ended up going, my dad said, can you go any farther? I guess Alaska would only be farther. I went to Seattle for my clinical work. So I started out in pediatrics. I worked at a children's hospital, but I actually did outpatient for the children's hospital for a while. And then I shifted and did outpatient orthopedics because that was more of my strong suit. I have a strong background in sports medicine, which I'll talk about a little bit later. So I lived in Seattle for 4 years, which was actually a really great time in my 20s to live. I highly encourage everyone to go visit there. And then I came back to North Carolina to work for one more year before starting my PhD in human movement science. So I finished my PhD in human movement science in 2009, and then I took my first faculty job that same year at the University of North Florida in Jacksonville, where I was on a tenure line as an assistant professor. I had the really unique opportunity while I was at UNF to also split my time between the University of Florida. So I was on a K-12 scholarship. So NIH bought out my time 75% for those 3 years. So I actually commuted on 301 between Jacksonville and Gainesville. If anyone's ever been on that road, they ticket you like crazy. And my whole goal was to not get a ticket. And I didn't the 3 years I went back and forth. But it was really neat to be at a more research-intensive university studying under some pretty strong leaders in PT education. Then after finishing my K award, I really wanted to do more research. And so I ended up taking a job at Creighton University. So I was an associate professor there, and I didn't stay very long, and I'll talk about that in a minute. Secondly, I had a second child at the time, and I wanted to get back to the East Coast. Being from Florida, my husband's from Virginia, and then I've got sisters in North Carolina and Alabama. So that brought me here. I have a colleague who's in the upstate, Chuck Thigpen, who we did our PhDs together in Chapel Hill, and he knew Stacy really well, and so he started messaging me when I said I was looking forward to maybe getting back to the East Coast. Spoke really highly of Stacy. I was really interested in this program. When I was at UNF, we had 30 students. I went to Creighton. We were at 55 going to 80, and I personally missed the small program size, so coming back to USC was a great opportunity for me. I also have a couple certifications in the PT world, so I'm board certified in sports physical therapy, and I'm also manual therapy certified. I do have a busy life, if this will go. I have an outside life with 3 kids. Oops, I didn't mean to go that quick. 3 kids and a supportive husband. This is not wanting to work. So you can see that. My husband is really what helps me do what I do, especially as I've stepped into this role. And then the other day, my son had to bring a picture of the family, and we're welcoming a new dog into our family. So I wanted to include that as well. That's Haywood. He's 6 weeks old. He's another newfie that we're bringing home in a few weeks. So I want to talk a little bit about my mentors because I feel like they're really what kind of set the stage for me as a younger faculty and even a student as an undergrad, thinking about maybe going into leadership down the road. In my undergrad at UNC, I met a lot of athletic training faculty, and they're actually some of the same faculty who mentored me during my PhD. So names like Kevin Guskowitz, who's now the chair of the chancellor at UNC, Darren Padua, who was also my PhD mentor. He's the chair in exercise science there. So they kind of set the stage for me as a young kind of student to really look at leadership. But I've been really fortunate in the PT world. At the same time I was at UNC doing my PhD, Dr. Rick Siegel was the division chair there. Some of you may know him. He's moved on to MUSC. But he and I developed a really good relationship, mentorship, partnership, and I actually still talk to him these days about some questions and if I have any thoughts as well. Probably the first faculty that really made me start thinking of potentially going into leadership down the road was Dr. Mettler. When I was at UNF, we had both our chair and PD leave us pretty quickly and pretty unexpectedly. Dr. Mettler was the chair in PD for the University of Delaware for over 23 years. He decided to come to Florida to kind of semi-retire, teach anatomy, be by the beach. And he was kind of left in an interesting position when our chair in PD kind of departed quickly. So we stepped in that role, kind of took over, and a lot of us at that time were really junior faculty. And because of his great experience, he kind of was able to push our program forward. I also, during my K Award, was really lucky to work under Dr. George. At the time at the University of Florida, he was the program director. So not only was he my mentor, but I also got to see some of his inner workings in that way as well. Also, when I was in Gainesville, they were undergoing a CAPD review, and CAPD came on board, so I got to see that leadership style as well. Along with Dr. George, I got to meet Dr. Mark Bishop. When I was doing my postdoc there, I did a lot of pain science education. Bish also does that, and he's now the new program director. He took Dr. George's role when he left to go to another university. I shared with you I wanted to do more research after my K Award, and I went to Creighton. And one of the, actually several reasons I went to Creighton was the leadership there and the female leadership. So I will say a lot of my younger times, the leaders were male dominated, and I was really kind of looking for more female mentorship and leadership because I thought that would be of value to me. And Gail Jensen, some of you in the PT world may know of her. She's the dean of the graduate school at Creighton, and she's very well published in PT education, and she's a plethora of knowledge. She and I still talk. I've talked to her recently about some things to get some guidance and advice from her. The other reason I went to Creighton was to be mentored by Debbie Givens. So Debbie was the chair at the time. Dr. George spoke really highly of her. She was a really great mentor for research, and I was seeking that out. Unfortunately, Debbie only stayed there for 2 months because she didn't tell me this, but she'd already taken a job elsewhere while I was onboarding, and she ended up actually at UNC, which is the whole irony of it. But Debbie and I still talk today. I actually reached out to Debbie recently about some curricular questions I had, and so she's another strong mentor that I can go back to. So I want to talk a little bit about some of the key players in PT education because I'm going to use some terminology here that some in the room may not be aware of. So CAPD is our accrediting agency, so they set the minimum standards so that we can be a functioning program. As you can see, we had our first accreditation here at USC in 2004. We had our last accreditation. They came in the fall of 2018. We were affirmed in 2019, and then we'll be going up again in the fall of 2029. So I'm not sure how other disciplines do it, but we do it every 10 years as long as we don't have any progress reports or anything to do that. The other player I'm going to talk a little bit about today is ACAP. So CAPD sets the minimum standards, but ACAP is really a collaboration of academic PT partners that really set excellence. So they kind of, in my opinion, go above and beyond, and they really push innovation and excellence and where should PT education be going. So I want to say, as I move forward and talk about some areas I think we can really have some good opportunities to discuss, is we're actually really good at what we do here at USC. So we sit in what's known as the South Atlantic region according to ACAP. So there's a lot of programs in this region. We make up almost 21% of all the programs across the country. I think Florida alone is up to 16 programs. North Carolina has 10. Georgia has 8. We're in a huge region. And Stacy asked me in 2020 to go to the ACAP regional meeting at CSM because she had a conflict. And it was really probably my first foray into understanding ACAP better. And you sit in these kind of meetings, they break out into your regions, and you listen to other program directors' chairs kind of talk about a lot of things. And I will say I went again this year at CSM when I was in San Antonio, and I sit there and I listen to a lot of other directors, and a lot of times they're complaining or what are the challenges and struggles, because that's normal, right? And I sit there and I think, gosh, we actually have it pretty good here. We've got support, we've got small faculty, we've got faculty that care, we've got students that care. And I just sit in those meetings and think how blessed we are to be here. And just to highlight that a little more, I could pull our 2020 NPTE as our licensure board exams. They break it out into different content areas, and then they can go systems, but I just wanted to show the content areas. This is our first-time test taking average mean scores based on the content areas. When you compare them to all first-time test takers across the country, not only are we meeting it, we're significantly exceeding the average across the nation. So I just say this because I think we're doing a really good job here. And I think, what I'm going to suggest are just opportunities to even enhance that down the road. Okay, so CAPTE does have aggregate PT program data that they do report. You can find it out there. Again, our first-time pass rate when I pull the last 3 years is 100%. When you look at the aggregate data across programs in the country, it's lower. So again, we're meeting and exceeding that goal. And I think the more interesting thing is you can benchmark our program against other programs across the state. And some people might be wondering, well, how the heck did you select, the other USC and Pitt and all these schools? Well, U.S. News and World Report has rankings, and you can look at what they claim, whether they're right or wrong, these rankings are. So these programs, these 10 programs historically are some of the top performing programs, and we wanted to see how we're doing against them. And again, when you look at first-time test rate, since we're at that 100%, we're exceeding what the top programs out there are. So again, we have a really strong program here. So when we look at some of the different CAPTE standards, I wanted to kind of go through the program director or my qualifications. So I'm a licensed PT. I've actually held my license in Florida since I first got it. It's one of those I probably won't ever give up. I'm licensed here in the state of South Carolina as well. I do hold a PhD, so you have to have a terminal degree in order to hold these program director positions. I'm at the associate level, so you have to be a minimum at the associate or full level to be a program director according to CAPTE. And then CAPTE also requires to have a minimum of 6 years of higher ed experience. I'm finishing now my 13th. I'll start my 14th year in the fall. And CAPTE also requires that 3 of those years have been in PT education. And I've been in PT education for all of these 13 years. So I do meet the qualifications that CAPTE is looking for. I want to talk a little bit about being a leader and where my background comes in and being a team. And it might sound a little cliche on some of the things I'm going to say, but it's kind of me. So this is me as a kid. I grew up doing triathlons. I really excelled in individual sports, specifically swimming and running. And my dad, we traipsed all over Florida with my younger sister doing these races. But my dad played basketball in college, and he strongly believed that as a kid we needed to learn to be teammates. And so I played basketball. This is me in high school. You can laugh. It's the 90s. I played basketball as a kid, even in grade school, and then I played basketball into high school. And I will say, when you're a kid and your parents do things, you don't think much of it. But when you get older and you have your own kids, you really start to understand. And his philosophy is something I hope to bring to my kids, because to me, playing basketball, I loved basketball for one thing. But you definitely learned things that you couldn't do in an individual sport. So that's kind of where my background in team comes. Jim, this is for you. I already had this in here. And then I went to UNC. I almost had a heart attack on Saturday, but that's okay. And that's also my favorite Tar Heel on the left, Vince Carter. But I was really at a unique time at UNC. My junior year was Dean Smith's last year. And when you go to UNC, it's a big basketball school, and you hear about philosophy. And I think I was just lucky to see him coach in his final year and then transition his way out. And Dean was one of those original coaches that really took the eye out of team. If you watch UNC still play, when a player scores a bucket, they actually point to the person who gives them the ball because they couldn't make that bucket without them. So I know it's cliche for me to say, but I really do have a lot of these philosophies kind of ingrained in me. A little bit about me. How many of you guys have done Myers-Briggs in here? A couple. So when I was in PT school, we did a Myers-Briggs, and it was actually really fascinating. And I popped out an ESFJ. I did it again recently because I know it can change, and I was curious to see if I changed. I'm still an ESFJ. Actually, the thing I changed in was I'm more of an extrovert now than I was back then, which probably makes sense for me. So I think understanding my personality is kind of important when I'm doing things like leading. I haven't done this, but I know athletic training has done this, and I know some other colleagues have used the anagrams. I think it's really important to understand personalities, communication, because everyone does it a little differently. And this is something I'm interested in exploring a little bit more down the road for our faculty. So again, I think if knowing what an ESFJ is, anyone else in here an ESFJ? No. Knowing what an ESFJ is, we really do care. We're almost sometimes too empathetic to a point. But I pulled a Dean Smith quote just for you, Jim, because I thought this was appropriate. But I really do care, and I think that's an important hallmark of being a leader. So I want to bring up, PT faculty in here do know this. You know, we have standards, CAPT, and I'll go through the 8 standards. Of course, CAPT is undergoing a revision right now. So there was town halls that occurred last month. A couple of us faculty sat in to see what were some of these standards that they're maybe discussing on changing. They're hoping to get going a document that will be out later this year for discussion. But CAPT is planning on changing or revising these standards, and those will go into effect late 2023, late 2024. Now, there's always going to be some time with compliance, but with the trajectory we're on and having to go up with CAPT in 2029, we're going to have to be aware of these standards. So I don't have these standards now, so what I'm going to go through are what is out there currently. So CAPT has 8 main standards. Within each standard, there's kind of sub-standards underneath that. And these were done in 2016, and that's what we follow today. The ones in red are the ones that I'm going to talk about on where I feel like we can work on enhancing our areas within the program. I think one of the first things we should really think about doing as a program is a strategic plan. When I went through the CAPT core documents with what we submitted in 2018, Stacy, did summarize and say, we really haven't done many strategic plans. We did one late 2015-16 when they were growing the program, but admittedly that's something we probably should do more of. And if you actually go through 2A and 2D on CAPT, strategic plans are outlined there and they should be documented. I've also been at the other institutions. I was at both Creighton and UNF. I was there and we did strategic plans. We did them every 5 years, and they really, I think, are good. They are time consuming, but I think it gives you goals, it gives you themes, and it's not just the faculty. You do have stakeholders oftentimes in these meetings, because it gives you a roadmap of where are we, how can we go, are we meeting expectations? And I think within that strategic plan, we probably want to look at our mission. Has our mission changed at all since the mission was developed? Can we enhance and improvement, or are we okay with that? The other thing is effective leadership. So when you look at CAPT Standard 4, that's all faculty, and then they have one specifically for the program director, and they talk about things like communication, assessment planning, fiscal planning, allocation of resources, and then faculty evals for non-tenure track faculty. And I'll admit, I've only been in this interim role for about 9 months. I'm still learning a lot, and I think there's a huge upskill and time in learning all of these types of things you have to do. I'm fortunate that 2 of my good colleagues recently stepped on board as program directors chairs, so I've gone back to them a lot to get some of their advice. And I asked one recently, I said, how long did it take for you to feel comfortable in the role? Like when you felt like you knew you were doing things in the right way? And she told me probably about 1.5 years. She said, there's a huge learning curve that you have, and I admit I'm junior in that role. But I have applied recently for the APTA Fellowship in Higher Education. So this was formerly known as ELI. I know Stacy did it. I've had several colleagues at other institutions do it as well. And their goal is really to give leaders in PT education, directors, chairs, the skills and resources to be innovative and influential. And 2 of the things I'm really looking forward to if I do get accepted in the program is they do pair you with a senior mentor. So they pair you with someone who's a chair or PD at another university so that you can have direct one-on-one mentorship. The other thing that you're required to do is a leadership project. So this is a 13-month fellowship, and in it you have to do a leadership project. And I've got some ideas, and these aren't new ideas to me. These are things all of us as faculty have kind of discussed over in the past year. So I'm hoping, I can build my leadership skills if I can be accepted into that program. All right, so what are some other areas that I think we can elevate or we can continue? And again, these aren't just my areas. We've identified these as faculty, and we've identified admissions as being an area that we can really look at, probably a little bit more in depth. We formed a subcommittee this year, and we're really trying to get better at writing down our procedures so we can be consistent, writing down our procedures so we can make sure we're being equitable in how we apply them. Additionally, CAPD does have a standard specific to diversity, equity, inclusion. I think a lot of healthcare professions have that these days, and we know in PT education, we're not really great at having a diverse population to represent what's out there in the world. It's being identified, and we're trying to work on how we can improve that. So I think that's an area the subcommittee is also looking at as well. The other plan is, and I kind of talked about the strategic plan, and they do go hand in hand, is looking at curriculum. And I'm not sure how it is in some of the other healthcare professions, but it's a little bit hard to find what should you have in your curriculum, what is entry level. And so we have some different buckets we can look at. Like I said, MPTE is our licensure exam. So we do have content outlines for the MPTE, and they go in systems and non-systems. So we can look at that, cross-reference, are we teaching what we need to teach? Within CAPD are the 7 Ds. So those are the standards that outline that are threaded throughout the curriculum. Now, I will say on the town halls, I sat in the listening sessions, and I've talked to some of the CAPD commissioners. They actually say that they foresee the 7 Ds becoming less prescriptive. So now I don't remember, there's a lot, 40 or 50 7 Ds, and they're talking about making them less prescriptive. So we could look at the 7 Ds and see what are and are we not including in our curriculum. The other thing is ACAPT. ACAPT has recently published a new strategic plan in late 2021, and one of their identified goals is academic innovation. And so they're really trying to develop guidelines for excellence. As I mentioned, CAPD sets the minimum standards, ACAP kind of sets the excellence standards. And ACAP did come out with a recent paper of their vision of excellence, and they talk about 77 competencies, although those competencies aren't published yet. I have a colleague who's on the stakeholder committee, and he said they're working on those competencies and they have them. But I think we can really look at our curriculum a little better. We shortened our program during a pandemic. So you students here know, it used to be 3 1/3 years, now it's 3 years. So not only did we shorten our program, we changed our curriculum a little bit too. And then throw on top of that, we had 2 very senior faculty retire, and we've brought 2 new faculty on. So we've had a lot of change in our curriculum, and I think we need to spend some time looking at that a little bit. I actually reached out to Debbie Givens when we've had some faculty discussions about this, because when I got to Creighton, she had done a huge revamp of their curriculum. So I knew she had background and some advice to give me. And she actually shared with me that UNC is undergoing a curricular revision as well, and she shared me her Excel sheet and mapped everything. She did say, I just want you to know that mapping a curriculum, looking at curriculum is something that takes time. It takes a lot of effort, and she said you're looking at maybe a 2 to 3 year time frame to really look at it, embed it, and make sure it moves in the right direction. So I think although it's going to be time consuming, I think it's going to be of great value and of need for our program. The other thing that's a big topic in PT education, and I imagine in other healthcare professions, it's a big topic in higher ed, is student mental health. And ACAPT did a recent study. They did a mixed methods study where they surveyed over 2,000 PT students, and they surveyed, I think, about 300 faculty, and they did some qualitative interviews as well. And what they were able to identify were areas of concern for our students. Academic performance anxiety, financial strain. PT school is not cheap. We know it's expensive, and this adds to all of these mental health issues. Clinical performance anxiety, so challenges on clinical experiences, and then just generalized anxiety. We know, I think it's a good thing that mental health is being talked about. I think for a long time it wasn't really talked about. And I know when Sonia Badasha talked to us faculty last semester, she said almost 70% of all students on campus here, both grad, undergrad, have some sort of mental health concerns. So we recognize that in PT education, and they're trying to kind of figure out what can we do to help with these challenges. And you throw in the pandemic, right? That adds to it. Well, ACAP did have a town hall, and they have a ton of resources. They actually have a really good website. They have a PowerPoint I know I've shared with faculty on how can we work on improving mental health, building resiliency in our students. And we've talked about this, and I think we've started doing this in our program, is integrating speakers into our classes. I'll admit, I teach the pain mechanisms and treatment course, and I never really looked at it this way. But after seeing what resources we have here on campus, I'm trying to better integrate those in our course because it's not only applicable to the patients, but it's applicable to the students as well. Just encouraging outreach. I know, again, like I said, a lot of times mental health isn't something that's always talked about, but making sure students feel comfortable coming to us or at least coming to someone. USC does have a lot of good resources, and they're building their resources, so being aware of those resources are important. I think us as faculty need to model the behaviors, and this is a challenge for us too. But things like taking breaks, seeking help within mindfulness is another area that they identified we could help with student mental health. And then lastly, the last area I think we do a great job in is ClinEd. For those of you in the room who don't know PT education, I mentioned like the state of Florida has 16 programs, North Carolina has 10. We historically in South Carolina only had 2. It was us and MUSC. But recently Anderson, so a private university up in the upstate, was accredited. And then Charleston Southern, Matt, you could correct me, they're seeking accreditation as well. So we still don't have as many programs as a lot of state, but they're starting to catch on in this state. But I think one of our strengths is our clinical partners. We have very strong clinical partners out there. And ACAP does have a new consortium, and they call it the NCCE. And because we're a member of ACAP, you can join these consortiums, free of cost. And so Dr. Gary and I have talked about joining this consortium. You have to have a clinical partner willing to join the consortium with you, and we're kind of in the work for that right now. Also, something Dr. Gary brought up, which I thought was really interesting, is potentially developing a ClinEd advisory board. So when I was at the other previous institutions, there was always more of a ClinEd team there. And we've never really had that here, but Dr. Gary talked about doing a ClinEd advisory board where you get stakeholders in the community. You have 1 or 2 meetings a year. I don't want to steal your thunder because I don't know it all yet. But I think it's actually a really good idea, especially as the state of South Carolina might get more competitive with clinical sites as these programs grow. All right, so I wanted to make sure I didn't go over on time with this. And I think the last thing, I was trying to find a Dawn's Daily quote, and I just couldn't find one that was appropriate. So I did steal a Mia Hamm quote that I really think it's not just me standing up here. I mean, it's going to take a team approach to do all these things and to keep us where we're at, maybe continue to make us excel as a program, and that I do recognize that being up here as well. So that's it. That's Haywood.
Can you bring him here?
I'm going to, once I bring him, yeah. My whole goal is to get him trained as a therapy dog so then I can bring him to my office. I was going to do that with our first, but then we had 3 kids, so that wasn't going to happen. So we'll see.
Okay, let's